Hello, Wes.
Hello.
Welcome. I'm really glad that you're here with us today.
Glad to be here.
So today we're going to be treating you with the Legend Pro, and I know that we're treating your face today. But can you tell me a little bit about why you're here, why you decided to come today?
I've had acne for as long as I can remember. From the whiteheads, blackheads, larger bumps that have left their mark on my face. I've had different craters, just pigmentation issues. I'm coming in today. I want to see what you can offer as far as helping my skin complexion.
Yeah, I see. So, looking at your skin, obviously you have a lot of scarring, both sort of texture change, the hills and the valleys, and also some of the little ice pick kind of scarring, and then some of the pigment change. So those are all things that we can treat using this device. So today we're talking about doing the Legend Pro for your skin, for your scarring, and help the texture and the color. So I can tell you a little bit about what Legend Pro does and how it works. So it's a radio frequency device that also has microneedles. It does microneedling, so it's a 2-in-1. So radio frequency sounds like radio waves, but essentially radio frequency develops this current in the skin, and it attracts water to one side, then to the next, back and forth very quickly, generating heat, this warm heat sensation, which stimulates collagen and tightens the skin. I think of it like shrink wrapping the skin a bit. And so it's highly effective on its own. But when paired with the microneedling, that involves these really ultra thin needles that penetrate through the skin with the radio frequency emitting from it. So it's warm, ultra thin needles that go through the skin and stimulate collagen and that same tightening effect. So it's a very comfortable procedure because of the way that you get this warm heat. It's like a warm knife through butter. Very, very comfortable. What questions do you have about the procedure?
Well, I've read that it can sometimes for skin of color can cause some pigmentation, discolorations. So I'm a little concerned about that, how it's going to affect my skin of color, and also just when I'm hearing the microneedling, the needling is I'm just worried about the comfort level of the procedure,
Yeah, so whenever we have pigment in our skin, we always are at risk of getting either lighter or darker. And a lot of different machines can cause a color change. In this case, radio frequency doesn't affect melanin in the skin, it's targeting water. And so by targeting water, it really tries to avoid that top layer of skin color. In fact, after the treatment with the radiofrequency microneedling, you can even have some improvement in your pigment because that top layer can lightly exfoliate, evening out your skin color. So it's highly effective. You can use it in people of all colors, all ethnicities. So for the comfort level, we'll be talking about that while I do the procedure, and I'll be asking you, how does it feel? But most people describe it as just a slight sensation of pins and this sort of sensation of warmth and heat, but they find it very comfortable. And you can let me know when you have it done, how you think it feels.
Okay, I will definitely listen.
Yeah, many of the procedures that I do, we use numbing cream beforehand, a lidocaine numbing cream for the skin, but with the Legend Pro, we don't need to do that. People tolerate it really, really well.
Oh, okay, that's good. No numbing cream, that's
a good thing.
Yeah, that's a good thing, yeah.
It's very nice because the treatment takes probably 20 minutes or so. Usually you repeat the treatment every 1 to 2 weeks. And then after a series, we stop and just allow that collagen growth. You see more improvement at 3 months than you do at 1 month. And then you can do additional treatments to fine-tune those areas where you have deeper scarring or more texture change, or areas where we need to get a little bit more pigment improvement. So we're working today with the Legend Pro. So the device has already been turned on. The screen comes up and it requests that you press the patient-controlled switch. That activates the software. The system's ready for use. There's several hand pieces on this device. We'll be using today the Voluderm. So with the Voluderm, it's radio frequency combined with microneedling. So we look at our tip. Check your expiration date. We're using the 36 long, the longer ultra thin microneedles today, and so that's on the outside label as well. This is our tip that we insert through a groove, and then you twist, pinch, and just pull the cap off. So now the handpiece is ready, and you see the microneedles on the end, which match the icon that's on the software screen. So now we are ready for our Voluderm. There are 3 settings on this machine. There's low, medium, and high. Today, when we start with our patient Wes, we're going to start with the low, and it has default settings for us. There are essentially 2. There's power and exposure. So for power, it allows you to select a percentage of the total power that can be emitted, which is 50 watts. So the default setting is 10%. And then for our exposure, the default is 15%. That's 15% of 400 milliseconds, which is the total range of exposure time that we can use on this device. And then there's a counter that just counts your pulses. So with that, we're ready to begin. So when you are using the Voluderm, and this is Wes, our patient today. Thank you for being here.
Thank you.
So Wes is being treated for acne scarring, for texture change, pigment change. He's had many, many years of acne. We discussed this since, I think you said, since elementary school even, when it's all started. So with the device, you first want to make sure that his skin is completely clean and dry, which has been done before. The dry is important because the Voluderm interacts with water, and we want his skin dry so that it interacts with water in the skin, not on top of the skin. So one of the other unique things about the Legend Pro is that because it's radio frequency, you don't need goggles, you don't need gel. The handpiece is quite small, it's very ergonomic and very lightweight, and it's very comfortable for the patient. Both the radio frequency and the ultra thin microneedles have this sort of warm sensation that glides through the skin, warming the needles and warming the skin as it inserts. So it makes it very comfortable. So we'll begin. So Wes, I'll have you turn your head this way. So we have a foot pedal that we use with this device, and you can see the little fine microneedles at the top. When they insert, they can go up to 1 millimeter deep. These microneedles are similar to a 35 gauge needle. So, so we use 30 gauge or 27. These are 35 gauge, very, very thin, very, very comfortable. So as we're doing the procedure, we can pick an area, lightly stretch the skin off the bone, gently press, and then press and use our foot pedal. You hear a little ping, you see the green light, and you can actually feel a slight vibration in the handpiece. And then you can see just gently the little square. You do your next setting at a 50% overlap. Again, press gently, press your foot pedal, you feel the vibration, you see the green light, you release. Again, 50% overlap, press gently, foot pedal, feel the vibration, release. How's that, Wes? How do you feel?
I don't feel a thing.
See? It's very comfortable. So then you can do the next area, press gently, 50% overlap. And obviously, as with any procedure, once you sort of get your pattern going, you can move right along. So we have the jawline here. We want to extend the skin a bit, so that you're not just right over the bone. So you can see sort of the texture change with some prominent pores, hyperpigmentation, slight scars with some elevation and depression. So we're going to stretch the skin lightly, press our foot pedal, feel the vibration and see the green light. And then next, 50% overlap of your square. For our purposes today, treating scarring, fibrosis in the skin, we want to affect the papillary dermis and the mid to deep dermis. Really, 1 millimeter is perfect depth because you're penetrating and heating probably the top 70% of dermis with epidermis. You're not getting the subcutaneous fat, for example, which may cause some depressions in this instance. You're really trying to remodel collagen at that mid-dermal layer. And then for the more superficial texture change that we want papillary dermis and mid dermis. So we can, now that we've treated all of this area, we can adjust, do a quarter turn so that you're treating, again, we're going to go over the same area, but we won't actually be going through the same holes with the microneedle, so we'll get an additional area of skin. So going over the same area in the same fashion, 50% overlap. So when you're selecting your settings for the Voluderm, it's always good to start low and work your way up, and that's true for any device. But as you become more comfortable both with the patient's skin result, you can start with a more aggressive setting, for example, over the areas that are highly scarred, and then go back over with a second pass with a moderate or lower setting. Areas where the skin is thinner over the bone, you can use a setting that is lower. So you can begin to adjust. Looks good. In some of the areas you can see like little thin pinpricks where you have the insertion sort of in a grid-like pattern, which is good. And then those areas over the next couple of days might feel a little bit rough. Usually this pinkness may last until tomorrow morning, and then may feel a little bit rough, that sandpaper feel as some of the skin exfoliates and lightly peels off. And then generally people look very, very normal in a couple of days. You wouldn't be able to tell that anything was done. So they can lead their lives normally and then return in 1 to 2 weeks for their next treatment. It's good to plan on doing a series of treatments, particularly for the kind of scarring that Wes has. You could do, as an example, 4 to 6 in a row, then pause, give a couple of months to see the effect of your collagen stimulation, and then reevaluate and decide that you're going to treat some additional treatments, particularly in the areas such as in these middle cheeks where there's more scarring. So Wes, in between the treatments, what is good to use is hydroquinone in people of color, just to make sure that you don't, we want something that will help us even out the skin tone. You can use a healing gel like aloe in those days just after the procedure. Wash normally, but without any scrubbing. You want to be gentle on your skin. And you can start seeing sort of the light redness on this side. I'm just going to catch up with his other side. Then we're going to go back and do the second pass to his forehead at the 45-degree angle to make sure that we've treated every inch. You did it!
Yay.
So you can see he's got that erythema that's starting to build again with a little bit of puffiness. You can see some areas where there are these light, subtle pinpricks of the ultra-thin microneedles. And then we are all set with our handpiece. And then we'll use a light spring water spray to his entire skin and give him some moisturizer that he can apply at home.
It was a very quick procedure. She explained to me I might feel a little penetration, a little heat. I felt the vibration when she applied, and that's pretty much it. It was a little. You felt a little more when it was against the bone, but all in all, it was very easy procedure. I would definitely recommend this procedure to others. If you're seeking professional help, this is the way to go.